Thank you so much, everybody. It's an honor to be here. And it's also very humbling that you are joining me tonight and want to learn more about this concept of mold issue. Sometimes we have so much things going in our life, including our crazy schedules that we actually have in our lives, family matters, etc. But we are also not feeling well, and you try multiple things and seems to not make any strides in terms of what you want to gain. And so the topic that I want to discuss is mold the reason you are sick? And I want to teach how to spot this as well as to be covered in the 5 simple steps. And the most important part is it's a comprehensive guide. This is a new topic, new ways in terms of really helping you understand the complexity behind mold toxicity. And this is another way to really teach about my method called the Encore Method. Encore Method stands for environment, nervous system, cellular health, optimizing detox pathway, rebalancing microbiome, and enhancing resiliency. So it's a step-by-step 6 point method in terms of recovery. And this could be applied for not only mold toxicity, but mast activation problems, gut issues, and such, that it is really the powerful road to recovery that I help to establish, and helping other people that are doing it has been getting amazing results. My name is Dr. John Kim. I have a total of 18 years of clinical experience. I received a Doctor of Pharmacy degree in Rutgers University back in 2006, completed my fellowship training in functional medicine and additional trainings in treating auto-infection disorder. This is how I got into whole biotoxin issues and mitochondrial medicine. And things that I work these days with clients is dealing with root cause medicine. So how do we reverse chronic illness in conjunction with gut immune balance and hormone dysfunction? And I actually actively lecture on the topics of mitochondrial dysfunction, cell danger response, and stealth infections. So my story, the reason why I started this whole journey was because of my own health. So if you look at the picture from the left to the right, this was only a 4-day difference. So back in June 2015, literally 10 years ago, my health turned to the worst. And what happened was that I thought I was dealing with heartburn. Instead, it was not. I was actually having a heart attack. And I just completely ignored the symptoms because I thought it was just a regular heartburn that I always dealt with. And the pain got so severe down to my left arm, I ended up going to the urgent care center instead of going to the ER. And this is how stubborn I am. And during that time, my clinical presentation didn't really show anything except for just chest pain, no shortness of breath, no sweating, just complaint of chest pain. And including troponin level, just really showcasing how much of the damage the cardiac muscle was incurring was less than 1. So even a cardiologist, including the ER physician, really didn't think that I was dealing with anything else except for probably pericarditis. And after echocardiogram was done by left ventricle, they found out that I was not contracting, possibility of ischemia. So there's some kind of blockage going on. When they brought me to the cath lab, they found that I had an 85% blockage in the left anterior descending artery. It's called a widowmaker. So at that point in time, cath was put in, and including after that, I was staying in the hospital for 3 additional days, wondering what happened, right? I thought I was having a healthy life. I trained in functional medicine. I thought knew what I was doing. But then all of a sudden I developed this issue, and now I'm in a hospital in a cardiac ICU unit. I was the youngest patient there. Matter of fact, I was the youngest patient to get a catheterization done. And so I had a lot of questions. So coming home, I sat on my couch for 7 days, still wondering what had happened. And I decided to look for answers. I reached out to my integrative physician friend. And when she first saw me, she plainly said, "Don't you think you have tick-borne illness?" I'm like, "There's no way." So that's why they decided to do additional testing. And following that, my hospital visit didn't end there. They over medicated me, actually. So I ended up going back to the hospital because I fainted and they had to readjust my medication. But after almost a month and a half of waiting, I was tested positive for Bartonella infection, mycoplasma pneumoniae, very high levels of mold antibodies and mycotoxins, and elevated Epstein-Barr IgG, IgM. So there was a diagnosis, undiagnosed Bartonella and mold toxicity may have contributed to cardiac presentation. And Treatment started, it was not easy, I'll tell you that much, because all the side effects I was going through in terms of just the severe herx reaction, body ache, many days I couldn't even get out of bed. And actually, I took 4 months off because I couldn't even function. And after 6 months, look at the difference in terms of my skin texture. In terms of my eyes as well, when you look at before and after, my eye itself is also very different in terms of just overall brightness. And these are common things that I see with clients who I actually work with. When we get the cellular health back, the skin complexion changes, their outlooks look different, they're much more calmer. And as well as one thing that I see is that their eyes are so full of life that something as intricate as cellular health is really impacting how they're looking into it. So today's agenda is understanding mold toxicity and the top 5 mold and toxin tips. I will also introduce you to the Encore method, what that looks like and how to do this. And it doesn't cost you a lot of money. It's the overall comprehensive approach, right? I'm going to be offering mold course next month. Tonight, I'm going to really teach you how to look at this in a different way in terms of how do we apply this, and as well as possibly a chance of working with me, and as well as a real patient success stories and your next step. So when you deal with mold toxicity, it isn't just about the mold itself. Mold just doesn't go to the brain. It actually disrupts the entire ecosystem. Mold actually breaks down the gut lining, the mucosal surfaces of your inner, inside your skin, your sinus cavity, cell membrane, you name it, it's setting up for inflammatory cascade. That's why people are so inflamed. They're constantly saying sick, including the joints hurting and gut inflammatory is another thing. And these toxins also are lipophilic, meaning that they actually bypass the blood-brain barrier. It could infiltrate the mitochondria, the liver, and your immune surveillance. That's why mold is so hard for the immune system to catch and get rid of. And mold is also a biological invader. They squat in your system, right? They aim to survive, they replicate, they grow. And on top of that, they hide from your immune system. So, key things I want to really jump into this whole 5 mold and toxin tips for tonight is 5 things I'm going to show you. Mold disrupt the gut brain immune axis first. 2, mold triggers lipid peroxidation. You might be wondering what that is. We're going to talk about how mold damages the cell membrane. And that's the main reason why a lot of people have trouble reversing mold toxicity. They're constantly having to go through their ordeal. Number 3, it's not just about the mold, it's about the terrain. I've been talking a lot about the terrain, what that is. I'm going to teach you what that is. 4th, this hidden mold is a rule, not the exception. And lastly, typical detox fails because mold actually rewrites the body's operation system. So tip number 1, mold disrupts the gut-brain immune axis. What is that? Gut barrier, your gut lining, basically. Everybody heard of leaky gut. Mold toxins actually destroys a tight junction leading into leaky gut and endotoxemia, meaning there's toxins that are being released from bacteria as well as mold and parasites are entering into your bloodstream. Now this is causing immune overload, where causing systemic immune burden, leading into not only gut inflamed, but gut brain axis being connected. There's neuroinflammation going on, resulting in a mood shift, cognitive decline, and brain fog. Especially yesterday, I made a post about how mold creates anger in the body, creates anxiety. Why? Because of neuroinflammation here. So mold isn't just in your head. It actually starts from the gut and the mucosal defenses. This regulates the neuroendocrine autonomic nervous system, where it disrupts the HPA axis. There's an elevation of cortisol, and then that elevated cortisol levels. If you're constantly getting stress response, this actually suppresses your immune system. Gut is going in a bad direction, leading into long-term exposure. And then you have signs and symptoms of people complaining about chronic fatigue syndrome, low cortisol. So it's not about viral infections. It's not just about COVID-19 infections either. It could be from long-term exposure from mold toxicity. Mold also causes a limbic system sensitization, meaning mold creating neuroinflammation increases limbic reactivity. So you're in a fight or flight state. And this also causes a vagal tone suppression, It actually impairs your GI motility, detox, immune regulation. So if you're complaining of constipation, for instance, right? You tried everything, right? You cannot go to the bathroom. It could be mold because why? The vagal tone suppression issues. So when I work with clients right after bed, we work on how to reverse, how to improve that vagal tone so that you could get your neuroendocrine aspect to be recovered slowly as you go through, including the mold issue. This in turn also increases the risk of SIBO, mast cell activation, and histamine axis. It's a very common complaint that I see people. And also the fact that mycotoxins cross the blood-brain barrier. So especially mycotoxins, when you talk about ochratoxin and gliotoxin, and these are some of the mold toxins you could test for the urine mycotoxin testing. They are small, they're lipophilic, they easily cross into the brain. This also activates neuroinflammation. And so that whole term called activating the microglia, this in turn causes mass amount of influx of inflammatory cells, including nitric oxide. You might be wondering, nitric oxide is good. No, it's not. If you have a neuroinflammation causing vasodilation, causing more nitric oxide delivery, causes more oxidative stress in the body, resulted in brain fog, anxiety, panic attacks, depersonalization. Oh my God, right? If you have mental health issues, right? If you are having all these anxiety issues, it's not about genetic. It could be mold issue related. So you don't have a brain problem. You actually have a leaky gut sending danger signal to the brain itself. And mold also affects your mucosal terrain, leading into leaky gut, as I mentioned before. So mycotoxin breaking down tight junction protein, allowing things like lipoprotein saccharides, right? That's affected. That is an endotoxin getting released from bacteria. And these things end up having to go into your bloodstream. And then now you have immune cells coming in and then trying to attack that. So inflammation there, fungal overgrowth and dysbiosis, right? So you have not only dealing with candida, a lot of people probably know about candida overgrowth, but it can also be related to Neisseria, methane producing bacteria as well. That's why you feel so bloated after you eat something. Biofilm formation as well. These are films, basically a cocoon protecting the pathogen from antifungal and immune clearance. This also can lead into immune suppression as well. So if you've done a stool analysis, for instance, I looked at the IgG level and a lot of people have an IgG level suppressed. What does that mean? Your immune system is suppressed and is already showing in the stool itself. That's a problem, right? That already shows a reduced mucosal protection and increased vulnerability to chronic infections, food sensitivities, and causing additional toxicity problem. Following that, now you're dealing with histamine secreting gut bacteria, Dow enzyme deficiency, where you may have a genetic predisposition, not able to breaking down mast cell. This can further exacerbate the problem. So what can I recommend you do? I would start recommending microbiome labs, IgG 2000, which is an immunoglobulin. Clostridium is also good too, like Omra. If not, Equip sells their Clostridium powder. Certain other mucosal supports like sulfur elm could be good, polyphenols, and combined neuroinflammation support such as limbic training, so heart coherent breathing, breath work, omega-3. I'll recommend special pro-resolvin mediators from Body Bio, it's protocol Resolvin, and as well as a phosphocholine from Body Bio as well. Tip number 2 is that mold triggers lipid peroxidation. That means that mold breaks down the integrity of your cell membrane. As a result, you cannot detox properly. Mold impacts your cell membrane structure to be damaged, leading into the cell membrane, the cell being really stiff, cannot get things out. And this also triggers cell danger response and membrane to be rigid, leading into further inflammation. And then when you talk about the intricacy of the inner part of the cell membrane, this also causes additional damages by mycotoxins. This also impairs your electron transport chain. So basically creating energy is disrupted and leading into fatigue, brain fog, and also pot-like symptom, right? A lot of people are complaining of POTS where they feel like they're going to faint on certain times. So when you're looking at mitochondria and looking at the mixture of mycotoxins, this is why mold toxin gets so misunderstood. It's not just about binders, right? Look what mold toxins can do, actually inhibiting membrane damages. There are all these things, including mitochondrial membrane problem, mutagenic, right? This can also lead into cancer. And then when you talk about trichothiocin, which is a black mold, it inhibits protein synthesis. So I've had clients where they're complaining of muscle wasting, right? They feel weaker, right? Damage to the ribosome, basically damage within the cell membrane, inside the cell membrane, also causing apoptosis, right? So your cells are dying basically. And then when you talk about zonolone, which is a mold estrogen mimicking mold toxin, this can also further cause damages on top of reproductive toxicity. Right? So there's been animal husbandry studies showing that animals are not able to give birth properly because of certain mold toxins getting involved. So this is really important to really discuss. So clinical breakdown is that mycotoxins causing damages and also triggering something called the phospholipase A2 enzyme. It actually further damages the cell membrane structure, leading into vulnerability of not creating energy. And mold isn't just passive, it actually dismantles your energy factor. That's why you cannot out supplement a damaged cell membrane, right? Let me repeat that again. You cannot take supplements, you cannot take binders, do all these things and trying to get rid of mold when you have a cell membrane that's damaged. This is a critical part. Number two, in terms of teaching about this. So what can you do? Utilization of phospholipids, right? That's why I love utilizing body bio. So it helps to rebuild the cell membrane structure. Hotka is also another important part where it helps to improve bioflow, improve the membrane integrity, and also reverses protein misfolding. What that means is that when you deal with mold toxins, the protein structure changes that also end up furthering the damage of the cell membrane structure. So this is where Tutka comes in to help with that. Balanced oil as well. These are essential fatty acids for membrane repair, helping to structuralize the inner membrane of the cell membrane, and as well as the N-acetylcysteine and glycine. I don't like to utilize glutathione right off the bat with mold toxins. It can further exacerbate the problem dealing with mold. So gentle approach into improve the redox regulation is so important here. Tip number 3 is not just about the mold, it's a terrain actually destroys. So mold actually weakens your immune terrain, also causes the limbic dysregulation. We talked about this, triggers vagal nerve suppression, leading into nervous system overdrive. I mentioned about the personality changes and mental health. When the terrain collapses, this also affects how well you're able to drain, how well you're able to detox. Detox failure comes in, and this also leads into chronic inflammation. If you are a sensitive patient, right? If you're having multiple chemical sensitivity issues, histamine response, poor tolerance to supplements, trauma, and also when you are in that fight or flight state constantly, they're all underlying issue, right? Mechanism is all laid out here. This all deals with the nervous system not feeling safe because of the hyper, and that's causing more of the hypersensitivity problem on top of your trauma. If you have a trauma background, let's just say you have gone through physical, emotional, mental trauma, that in itself heightens the response of your nervous system to constantly react to whatever is in front of you, especially supplements. So if you've been trying multiple protocols and such, and you cannot get through the overall recovery you're looking for, this is the reason why, right? There's that nervous system dysfunction that's not being addressed correctly. No supplement is going to fix that problem. This is where coaching, proper coaching, and as well as ways to help address the cell danger response naturally in lieu of respecting the body to feel safe and then shifting into that recovery mode is so important. And I've done this many times with clients where they tried multiple supplements and practitioners and all different things and cannot get to the recovery they're looking for. Now, have I gotten this right away? No, absolutely not. I've failed a lot of clients. But over the years, working with them and having to go through and developing that Encore method is exactly what I have helped address. And that now people are starting to recover faster for that reason. And why terrain must be stabilized first, right? Patients do not need more killing protocol. It's not about the killing. It's not about the binding. That's not it. You need to regulate your nervous system. You need to repair the cell membrane and mitochondrial function and resiliency building habits like circadian rhythm, red light therapy, breath work, right? These are the most important parts that we need to do instead of just kill mode, right? So treating the nervous system before the immune system is what you do to create safety before stimulation. You could use gentle binders like aloe or sometimes other things that are activated charcoal could be great. And improving bile flow, like Taka could be good, ox bile, some of the bitters that could be utilized in here. But if you are very sensitive, you may have to incorporate those in very slowly. And mitochondrial rehab, targeting nutrients to restore cellular energy and membrane integrity. Tip number 4, hidden mold is the rule, not the exception. The issue is that mold end up having to hide multiple areas of your house, including places you work and your car as well. And sometimes these mold cannot be visible. You cannot even smell them either. So if you're having unexplained fatigue, histamine symptoms, having weird infections, brain fog, food sensitivity, all those are related to mold symptoms. And if nothing seems to work and you tried everything, mold is the potential cause, right? So basically your body's screaming that, hey, I'm having issues here. And mold is basically the whisperer of sabotaging your basic health. And so the environmental input is everything here. Mold rarely is isolated. Often they are found in other things as well. Volatile gases in the house, EMF toxicity, Wi-Fi exposure, chemical cleaners, heavy metals, right? It's not about the mold. It's everything. So how do you test the environment? You want to hire a professional mold testing company that could do HERMI and other types of testing to check for the type of mold you're dealing with. Air sampling should only be done after you're doing a surface testing. So you see that guy taking a swab right now, that's surface testing to see if there's any mold issue going on there, followed by air sampling to see what's floating around. Also moisture mapping. If you have a house that has above 50% in moisture, right, humidity, you have a high risk of developing mold. And on top of that, there are hidden areas. We want to look beyond the visible issues. So HVAC, dust, dishwasher, under the sink, right? These are the most often missed part, right? So if you are not able to find mold, sometimes the simplest areas could be the source of the hidden danger you're dealing with. And when you are mold remediating, this is a must. You cannot bypass this part in order for you to, and then try to think that you're going to recover. So when you're hiring a mold remediation company, you cannot be doing, you cannot go through the remediation process by just hiring some Joe Schmo contractor down the street. You need to find somebody who is independent, who actually has the credentials, right? And not only they end up having to review the lab results and not providing biasness, but giving a clear direction of how to deal with the visible and hidden mold issue, followed by giving you direction, step-by-step process to contain removal, cleaning, and filtration and testing to prevent leftover mold spores. I've had a client this morning, I had a call with her, first time, and same thing. She said she hired this expensive mold remediation company that came in, and then they spew all that mold particle all over the house and didn't contain the problem. And so she got even sicker because of it. This is the reason why hiring a right professional is so important. The essential role of remediation in recovery is also key as well. If you do an incomplete or improper remediation, often causes a relapse and people getting constantly sick because of it. And environmental testing recommendation as well. I mentioned about these things, but also HEPA filter. The one other HEPA filter machines that I recommend is Jasper. So if you are looking for a good HEPA filter, this is what I recommend doing. And the code Conquer Mold as a coupon code is going to give you $200 off tonight if you want to purchase that. And it's one of the best ones that I've used. I've had Air Doctor. I've also had Molecule as a HEPA filter, and Jasper is one of the best ones I've seen. It's so smart. It's actually detecting volatile gases and is able to get your airflow change and such. And it's the only company out there has shown to neutralize mold toxins. So it's really important thing to find the right unit to help clean out your air quality. And tip number 5, the last tip I want to share for tonight is mold detox program often fails because mold rewrites the body's operating system. What does that mean? Mold is an epigenetic disruptor. They form something called a DNA adduct and they alter your gene expression. That's the reason why when I mentioned about certain mold toxins are connected to cancer, these things end up leading into long-term cellular confusion, could be leading into reprogramming, which affects your methylation process. You cannot create energy. And it is also disrupting the immune surveillance. So think about autoimmune disease, right? Why is people end up having autoimmune disease? Is because of the epigenetic changes within the immune cells, leading into your immune cell cannot distinguish from the self to the non-self. That's what autoimmune disease is. And this is what mold can actually do to you. So if you're dealing with childhood trauma, unresolved emotional stress also creates a nervous system that triggers, and this also can actually affect epigenetic expression. And then when you deal with cell danger response, that freeze mode where body stops healing and trying to conserve energy in response to perceived threat, this is also affecting how well you're able to express that epigenetic and genetic expression. And modern exposure dealing with EMF, blue light, and indoor environment also impairs the way that you're able to detox as well. So all of these things end up having to affect your body in order to heal, but also reprograms how your gene is expressed. So modern exposure, the hidden disruptor that I want to share with you today, EMF and blue light impact, right? So blue light, for instance, in terms of looking at the computer screen, your cell phone is all over the place nowadays, right? It actually erodes the mitochondrial communication. It actually depletes melatonin production, but also reduces heart rate variability. HRV shows how resilient you are to handle stress. Unfortunately, when you have a low HRV, you're more likely not able to function well in a full energy, and recovery process very slow, and you could get even sicker because of that. And this also, EMF and blue light toxicity also impairs the way that you're able to detox. So if you are dealing with MTHFR gene issue, if you're already having trouble, here it is. There's the only reason that you should be looking at to getting rid of the EMF and blue light and controlling your environment. This is a reason why. So beyond binders as well. So things to really look at when you talk about detox, right? It's about the survival code to reset. And this is a concept I want to really teach you today is that mold triggers. And however, the terrain aspect into what you are living through, these are these things that you end up having to really help to change in a positive shift, leading for you to recover correctly. So don't just jump into binders and antifungals. And this is a problem that a lot of people go through because they think that killing mold is going to be a problem. No, I just mentioned to you what other things could go on, right? So you want to rewire your nervous system by doing breath work, somatic healing, vagal tone improvement, shielding from modern exposure, dealing with EMF, and also supporting epigenetic and detox pathways so that your mitochondria cell is able to function well, followed by bile moving, and as was membrane repair nutrients like use of phospholipids is also critical in this process. So you don't need to be stuck forever, right? But there's always light at the end of the tunnel. So you need to reframe the problem. You're not broken. You're just basically responding appropriately to the toxic hijacked environment. Also, mold isn't a detox issue, it's a terrain takeover. And you need a multidimensional strategy to reverse the problem. So there's no cookie cutter approach. Everybody's different. Everybody's unique in this sense. But at the end of the day, you don't have to be stuck. There's always a light at the end of the tunnel. I've shown you 5 critical ways to reversing this issue. I want to introduce this Encore method. And it's the exact methodology I teach my clients as well. Encore stands for environmental assessment, nervous system regulation, cellular repair, organ detox pathway, rebuilding the microbiome, and enhancing resiliency, right? You cannot just repair cellular issues and the organ detox when your nervous system is dysregulated and your environmental is shot from the mold toxicity, including EMF exposure. So what you need to do is you need to go in a step-by-step approach in a counter-clock mechanism to help you really unravel that mold issue and the cell danger response problem that you have so that you could recover quickly and gaining your body back and also helping you to enhance a long-term resilience because you need to sustain a healthy level of life so you could thrive and enjoy your life again. Right? They've gone through so many practitioners, so many supplements and protocols, and they cannot seem to get things correct. Why? Because the critical part in dealing with the nervous system regulation, the environmental factor could be often missed, and then they just jump into cellular repair. They can't tolerate any supplements, so they feel stuck, right? But then if you don't address the cellular repair and then go straight into organ detox, that's not going to work either. So everything I'm showing you right now is in a unison way of getting through a recovery and reversing the mold issue you are dealing with. This is a client that I worked with for almost a year and a half. And she was going through so much mold issue and she got through so many doctors and such and cannot seem to get through the overall recovery that she was looking for. But after that, I ended up having to work with her and I taught her that it's not about the binder, but it's about the depletion of nutrients as well as working to supplement proper food and lifestyle changes, including nervous system regulation in order for her to feel calm so that she could actually recover properly. As a result, she found out that she was dealing with additional mold issue. She thought she spent all this money to remediate mold, found out she was dealing with additional problem in the attic. So after the cleaning the environment, and then as well as additional nutrient protocols, and this is a part that's really helped to allow clients to look at this in a more thoughtful, comprehensive approach to getting their body back in order. This is often missed, but I take the time to really teach my clients how to succeed. Another story that we actually had is this same client as well. She worked through several issues dealing with heavy metal toxicity issues and mold, but it's always the fact that she was reacting to everything. So one of the things that we worked on was her nervous system. Right? How do we promote safety in her system and her body so this way is able to accept, not even just accepting, being safe to proceed to healing. This is the part that's really missing. So this is the part that I work with my client here, same thing issue as well. And so she was able to get through the overall challenge that she was dealing with. This is another profound case where I didn't remember I said this, but apparently I did. It seems God, she has a weird sense of humor in terms of talking to people during webinars, right? This is something that I said to my friends sometimes. You could do all the right things, but still not get better. The reason being is step-by-step approach really matters, right? So this is a part that client learned about, and I taught about how to reconnect to herself and her faith, but namely how to get her nervous system issue under control so that she doesn't become burdened by her physical issues and environment, right? She was constantly getting react to that. But also another thing was that she was also traumatized in the past, and that anger and the trauma is also causing that problem. So in terms of talking about forgiveness, talk about how to regulate, how to let things go, right? This is an important part that I teach my clients to do so that you could get through the recovery you're looking for without relying so much on the supplement itself. So there's a case example that I want to share with you. There's a 38-year-old female living in a New York City apartment, and she found out that she was black mold, being better in the hospital a couple of times, didn't know what was going on, constant fatigue, food sensitivity issues, couldn't even tolerate regular binder and detox protocol. So once she started working with me, the first thing we did and found out was that she was so shot in terms of nutrient, but also her nervous system had to be re-regulated. I worked with her one-on-one and really adding on the necessary fats to help the membrane support, implement the bile flow and detox, and gradually getting her biotoxin issues under control, rebuilding the gut. And the outcome, this happened to be done in 6 months, regaining energy, start tolerating supplements again, minimal reactivity to the problem, and returning back to normal activities, right? Now, there are still certain challenges in terms of food, but in terms of what she was dealing with 6 months before, it completely disappeared. Why? Because we work in a step-by-step approach to help get the body back in order. So that's basically the conclusion of my discussion tonight, but I want to really leave something, a opportunity to work with me. So if you have worked with other practitioners, nothing seems to work. And if this presentation is resonating with you and you're wondering how I can be that kind of people that we cover using the Encore method, this is a part that I want to offer you as a gift. So usually for discovery calls, I charge $250. And this is a very comprehensive approach. I think one of my clients is actually here on the call, but I'm very comprehensive in terms of working with you in looking at the current symptoms, your health history, and looking at what's driving this dysfunction. So not only looking at the mold exposure, but I want to see how your nervous system is functioning, gut imbalance and such. But following that, I like to also give a personalized recommendation. Following that Encore method, I tailor your unique challenges to reversing it. So that's the $250 that I end up having to offer for all my clients. But for tonight, as a bonus, I want to give you a mold-free nutrient guide. That's a $50 value as a gift once you sign up, as well as a mold inspection checklist so that you have a full comprehensive guide to approaching mold issue at home. So usually if you combine everything right now, that's about a $600 value. But for tonight, I want to give you a special gift as a $150 offer for you to join. If you are interested in this, I'm going to share the link very soon, but just I want to share you a couple of things as of what I'm doing. So in terms of the Encore method, 6-pillar recovery process, I just shared with you before in terms of the environment, the nervous system, cellular repair, organ detox pathway, rebuilding the microbiome, and long-term resilience. And as was a key areas that I address within my consultation, not only mold issue, but nervous system dysfunction, mitochondrial burnout, gut microbiome, hormone rebalancing, as well as the environmental issues that you're dealing with. So that key things should be addressed, and getting your life back is one of the key things that I end up having to help with this process. And the mold nutrient guide, this is just a picture of the anti-inflammatory diet, but it's a very strategized approach into how to support your mitochondria and be mold free and helping to nourish the body correctly based on a mitochondrial approach. So that is a $50 value that I usually sell. That will be free gift once you sign up. And I'm also going to give you a mold inspection checklist. It's a step-by-step identifying hidden mold issues and DIY assessment tools, as well as a vendor selection criteria for professional remediation. Things that I made mistake on, I don't want you to make those mistakes either, right? So I put that as a key things within that mold guide, mold reinspection guide, so that you don't have to make the mistake that I made. So that's a $300 value. I end up having to add it into my mold course and as well as the one-on-one clients, but that will be given to you as well. So why this approach is different is beyond symptom management. It's also personalized based on biochemistry. It's also comprehensive system approach. And it's also gentle and progressive, right? You want to work with in this process of slowly unraveling the problem so that you're able to recover properly here. So if you're wondering, is this something, what if I'm not sure if the mold is my problem? After the consultation, we're able to factor in what the symptoms you're dealing with. So that's why this is a discovery call. Now, the second question could be, I've tried many detox programs before and felt worse. That's the problem is that many detox protocols just jump straight into elimination without preparing the body first. Do I need to leave my home if there's mold? Not necessarily, right? We'll assess your specific situation, develop strategies, and helping you remediate this process along with working to getting your body back in order. Who is it for? If you try multiple other doctors, nothing seems to work. If you're sensitive to medications and supplements, if you're dealing with environmental factors and having health challenges and more, this is the program for you. If you have tried many things and nothing seems to work, this is why we set this program up. So the next step is for you to schedule a consultation with me. And there's going to be a form that's going to be sent to you as a pre-consultation assessment. We'll give you customized recommendations as well as a free bonus material, and you're able to get through the beginning of the mold recovery journey as well. And so for tonight, like I said, everything included is about a $600 value. For tonight webinar special is $150. So that's the conclusion of my webinar. And what I'll do is I'm going to drop the offer for you so that you can sign up tonight. And if you need to take some time to think about it, I totally get it. But I would highly recommend taking actions now because you know exactly what happens if you don't take any actions. So I will stop sharing.